All right, class. My name is Isaac Ofori-Amanfo, a current student in the nurse practitioner program. My presentation today is on substance use, specifically cocaine. And here we go. So my first slide is going to talk about introduction to cocaine, the substance itself. So it's classified as a stimulant. It's one of the very most psychoactive drugs being used and abused worldwide, including the United States. It's currently a global problem and it has a high morbidity and mortality rate. The chemical cocaine is an alkali substance in goes chemically and it's prepared biosynthetically from a particular plant with the scientific name Erythrocylum coca, which is very much common in the South Americas. Um, the white substance, which is very much common to us, which is the pure cocaine, also known as blow, snow, Charlie, C, is the white substance, the white powder specifically that we normally see. Is actually very much soluble in water. However, it's the type that is usually snorted through the nose by the abusers. And then we have the crack cocaine, which is also called the rock base. Is a yellow solid substance that is usually abused by the abusers in a crack pipe. Cocaine, like I said already, is a psychoactive substance, very addictive, can cause impairing medical and mental issues. It's currently a Schedule 2 drug in the United States. And then initially, and for a long time, cocaine, other formulation called cocaine hydrochloride. Cocaine hydrochloride is available still in the US as an anesthetic that was used for surgeries in the ear, throat, and nose initially. But now its use is quite less because it has been replaced by newer anesthetics, which are very much safer. Now, if you talk about the history of cocaine abuse, um, so the people of the South America found this shrub called the Erythromycelium coca. They found it that they were chewing it initially because they found out that it had this high euphoric feeling that was giving them a lot of energy whenever they used to work. So they kept on using the chew the leaves for a long time, and people were getting high, and then of course they got hooked to it. A German scientist in the 1860s was the first person to isolate the cocaine actually from that plant. Was able to chemically in the laboratory isolate it from there. And then from there, he also found out that when he put the substance on his tongue, it had this numbing effect. And so medically, they found out that they could use it as anesthesia in surgeries. Sigmund Freud, as we all know, the founder of psychoanalysis, was a guy that was among the first people that experimented with the drug, but unfortunately he got hooked onto it and had a problem, had a struggle trying to break in that addiction. He actually had it going on for like 12 years. He was so fascinated with the substance cocaine. In 1886, we all know the popular Coca-Cola. If you don't know, Coca-Cola in the past had cocaine as one of the addictives. But in 1903, because of the health problems and the kind of addiction people were getting to it, cocaine was removed from Coca-Cola. It became popular um, in the 1980s, and I mean the crack part of the cocaine became popular in the 1980s, and a lot of people rushed to use it because crack cocaine was very cheaper. And then if you take a little smaller, you're gonna have a very high effect from it. And that was in the 1980s. And then, surprisingly, when crack cocaine came in, the users of cocaine increased from 4.2 to actually 5.8 million. Cocaine actually is regulated in the United States right now. It's considered a Schedule 2 substance, and which is basically illegal to use right now by the populace. Epidemiology. About 20 million people abuse cocaine worldwide. And then if you take the age from the 15 to 64, this represents about 0.4% of the global population. Is used most prevalently in the South and the North America, and that's basically because the plant that has the cocaine is extracted from, is basically found there commonly over there. But then drugs get transported across the globe and go to other countries. So it's being least used in Africa, Asia, Eastern, and then Southeastern Europe. And right now, approximately 5.5 million regular users of cocaine are in the US. What causes people to abuse cocaine? What are the risk factors? Um, it has been linked to familial, psychiatric, and socioeconomical factors. Males, by proportion, uses cocaine more compared to females. People in single, solitary relationships that are not engaged or not in any relationship also are high risk for abusing cocaine. And then concomitant substance other substance use like cocaine, like tobacco and alcohol put them at risk for using other substances too. And then people who also have personality disorders like borderline and antisocial personality have been found to be at high risk for both abusing cocaine. And then there's a strong genetic factor. We tend to be running in families. If our family members that abuse cocaine, there's a high possibility for about 65 to 79% that the person is also going to be abusing cocaine, maybe now or in the future. And then people who have been subjected to adverse childhood experiences, had childhood ADHD, are also at high risk for abusing cocaine. What is the effect of the substance use? This cocaine can have both short and long term effects. Short term effect could be from the acute withdrawal symptoms and what they're presenting to you right now. And basically, in the short term effect, you could have physiological, which is physical aspect. Patient present with tachycardia, pupillary dilation, profuse sweating, nausea, tremors, movement issues, appetite suppression, and weight loss. Behavior, they're going to be restless, agitation, repetitive stereotype behaviors. And then psychiatrically, you're going to have dysphoric mood, you're going to be anxious, um, panic attacks, suspiciousness, they're going to be having trust issues, paranoia, grandiose fear, elated, and then impaired judgment. And then, of course, they're going to have withdrawals and then be craving for the substance. Long term effect mostly is going to be um, what is gonna happen to them when they keep on using it for a long time. They can suffer actually stroke, seizures, cognitive impairment, especially their attention, executive function, and memory loss, and of course headache too, psychiatric. Using cocaine put people at risk for committing suicide and also having suicidal ideation, and then of course predisposes them to cocaine-induced psychosis, hallucination, and delusions. Cardiovascular, they're going to have chronic hypertension, coronary artery disease, myocarditis, heart failure, and of course, irregular heart rhythms. Cocaine initially could be considered like aphrodisiac that help people to perform in sex, but chronic use has been associated with impaired sexual function. And then people who use cocaine, especially those who inject it, they are gonna be, susceptible to STDs, and also partly due to the fact that they're gonna be also engaging in risky sexual behaviors like unprotected sex and stuff, which all of them will put them at risk for getting sexually transmitted diseases. And then people who continue to use cocaine, especially those people who snort it through their nose, are gonna have their nasal certain perforated or maybe some type of deviation. Signs and symptoms. When we have patients presenting to us, what are we going to assess as providers? We're going to see that we're going to have some insomnia, high energy, euphoric mood, tachycardia, high blood pressure, alertness, agitation, anxiety, nausea, craving, skin lesions of mass of the drug injections. Their nasal septum is going to be perforated. They're going to have some psychosis or paranoia, hallucinations, mood instability, confusion. And then of course, when they are withdrawing, because it's a stimulant, they're going to actually have some more of a low mood because it kind of give you the opposite effect. So you're going to see them low mood, kind of withdrawn, not really interested in, activities, be like stay in the bed and stuff, all that kind of stuff that you can see when they are withdrawing with cocaine, which is basically a stimulant. What is the potential for overdose of cocaine to use as a suicide weapon? The link or the correlation of using cocaine as a suicidal weapon has not actually been established, but continuous use of cocaine has been linked with the possibility of having more suicidal ideation and suicidal attempt in about 20% of users. So other factors like other comorbid mental health, other substances that you're using, family history of substance use, and predisposure to childhood trauma or childhood condition like ADHD could be one of the some of the factors that will predispose a patient to having suicidal ideation or attempt when they use cocaine. So, what is our treatment plan? Um, when people who are abusing substances, cocaine, for instance, there's not one clear cut approach for us to say, oh, this one is superior over the other. I've always thought of this as a multimodal or using the multidisciplinary approach when treating addicting disorders. Cocaine actually is going to be some type of stimulant use disorder, specifically cocaine. And then when you approach it and you're trying to treat the addiction, you should always think first about using psychosocial intervention, like using therapies. Of course, you're gonna probably refer them to individual or group therapies. You can also try and use CBT, which is cognitive behavioral therapy, which is gonna help them, transform their ill perceived thoughts about using drugs and then make them think positively. And then we use scenarios about people who have gone through cocaine addiction and the effect that they had is going to have a good impact on achieving remission with this patient. Also, the use of motivational interviews also is very important. And then, if we try psychosocial interventions like as mentioned as therapies and they don't work, then we can also supplement it with pharmacological interventions. The other medication that have been tried includes like topamine, which is also called topiramate. It's a GABAergic medication which is primarily inhibitory neurotransmitter transmitter that's going to deactivate or kind of reduce the effect in the dopaminergic pathway, which is also implicated in addictions. And so using topamine is going to reduce that effect, which is also going to reduce the possibility of addiction when they use cocaine. And then if that don't happen, we can also use a long-acting amphetamines. Long-acting amphetamines have this slow, long-term release. And so instead of using cocaine, they'll use another stimulant. And the fact that it's a slow release, it is safer. And then the possibility to hook on to it is gonna be high. And then they're gonna have possibly the same effect from it, but the addiction is gonna be slower. And then with time, they will be able to control and not use the cocaine. If that don't happen, if that don't work, we can combat the Topamax with a long-acting stimulant, and then also while they also still go on and still use the therapy, which will basically give the maximum effect if we want our patient to achieve remission. And then, of course, we're not going to forget about underlying conditions. If a patient have depression or anxiety or some type of personality disorder or some mood instability, bipolar disorder, whatever they have, we're gonna employ other psychotropic medication into it and then be able to treat that, because treating that is going to reduce the fact that they will use drug or cocaine to cope whenever those symptoms are high. Um, other Another thing I'm going to talk about is we also going to be educating our patient that cocaine use has nothing positive on their life. It's going to affect them physically, mentally in the long run, their socioeconomic effect, their money. Um, for typical example, seeing a lot of people using drugs, who are homeless because they were hooked on, they would rather use the money to buy drugs rather than, find a place to stay. You're going to also refer them to support groups, community resources, and then help them identify the triggers that made them use the drug, and then they will develop coping strategies to deal with them rather than using the cocaine to suit themselves. That are so basically, based on what I have said, what referrals are we going to make? We're going to refer them to psychotherapy, basically 12-step groups, like the NA group that they can join. People who have been through that process and have achieved remission will be able to serve as a role model for these patients who use cocaine so that they can also achieve remission too. We are also going to refer them to primary care providers who are going to look at their general health and be, checking something like their blood pressure or other health issues, and strokes, make sure they are okay and all that. And then after all that, if we do all this for patients and they are not following up and we're not doing a periodic follow-ups with them, the possibility that they don't see no sense or need to move on, go on with their treatment is going to be high. So what we're going to do, we got to make sure we have some start to sit down with them and have some follow-up plan so we can discuss about the treatment, what is going on, what is not right, if the medication is working, do we need to increase dosages or we need to take them off, what kind of treatment changes that we need to make. That's the importance of the follow-ups. So basically, in conclusion, what I want to say is cocaine is very addicting. It's a strong psychoactive stimulant that's very highly abused by people across the globe, and in the US too. I would say it's not a global pandemic, and it is very addicting, have very impairing consequences on both mental and medical, um, mental medical aspect of abuses. Addiction treatment follows multimodal approach, including therapy, pharmacological, and medical approaches. Next, nurse practitioners should play an important role in helping patients and their families to achieve remission by giving them the proper education, referral. We need to motivate them for follow-ups. This is the best way we can help and assist our patient in achieving remission so that they will not experience these consequences that cocaine addiction will have on them. And possibly achieving remission should be our priority. Thank you.